Hello and welcome to another edition of A Lot of Help with James Lott Jr. I am James Lott Jr., certified life coach, former nurse, and host of all things podcast, the podcast world. And now I'm going to bring somebody else because we're in this kind of world of now virtual reality, so to speak. We're doing, a lot of businesses are doing things through virtual means. And I'm going to talk to somebody who's also going to talk about that in their business, in the world of plastic surgery. He's from Orlando, Florida. He has a lot of awards. You see some right there behind the best ofs and things. He's good. But he's a board certified plastic surgeon, specializes in rhinoplasty, primary revision, and body contouring reconstruction. We're going to talk to him, and I'm glad that he was able to spend some time with me today. Dr. Tom Trevisani. How are you, Dr. Tom?
Well, I'm good. I'm good as can be expected under the circumstances since we're shut down for now, but hopefully we'll get to open soon. Looks like we're on the road to do that, meeting certain requirements, but yeah, we're stuck like everybody else.
How's the family? Everybody's okay? Everything okay?
Everybody's healthy. My mom's 90 and she's living alone in New York, but she's still healthy. I'm here in Florida. I stay in contact with her on a regular basis, make sure she's okay, get her food, gets her cleaning done and her laundry. So we're cool there right now.
Good. Very good. I'm glad I was going to ask you. I'm glad to hear that. So I'm glad everybody's doing okay. Now, something I think is very interesting. I was saying at the top of the show is that a lot of industries. I interviewed a guy who now does virtual consultations in dentistry. Like people are now beginning to switch over to things where we have all this technology now that you can do this. So, first of all, talk about your business. And you've been in business for like over 30 years. You've been doing this for over 30 years.
Yes. Well, I got into plastic surgery in kind of a roundabout way. I was working in the emergency room in upstate New York, and I was on call many nights. And the trauma, my performance as a physician in the emergency room, drew the attention of the board-certified plastic surgeons in the area. And they would come in and say, who sewed up this child? And me. He said, well, you've got a gift. You better pursue it. And that was the first I had ever heard of plastic surgery as a profession. So I then embarked on a 7-year process from that point to get certified as a board-certified plastic surgeon. But the deeper I got into it, the more excited I got about it and realized that this was really a perfect fit for me because it helps me create. Well, first of all, it helped me repair people who had injuries. And I did many years of doing microvascular surgery, reattaching limbs and arms and legs, and doing all kinds of trauma work, but which served as the basis for me to get into cosmetic. So it's really important to me how people look. Beauty matters. And that's our business, is helping men and women look their best. And we find that very fulfilling and very enjoyable.
So, I mean, you're talking like back in the 80s, basically, when you were kind of
back in the 80s. I was inspired by the plastic surgeons in my community to pursue this as a career. And I took them seriously because I figured, well, they knew what they were talking about. And they saw something in me that I had not known of before. And I've learned through time that every human being has at least one gift. And every human being has at least one passion. And when your passion finds your gift, you have a life. And that's pretty much where I am today.
Where your passion has a gift, you have a life. I love that, Dr. Tom. That's a great statement. I love that. I agree with you completely. This is my passion, so I agree with you completely. You've seen the advancements from the 80s on to today in terms of rhinoplasty and body contour. I mean, you've seen all that, haven't you?
Oh, fantastic! Yes, the suture material, the wound care, the level of perfection that we've achieved in today's world is astounding. Back in the day, we would never even conceive of some of the redesigning of the human body that we're able to achieve today. And that's one of my passions, in addition to rhinoplasty. I mean, somebody's 400 pounds and they lose 200 pounds. They have more excess skin that they care to have.
Right.
And so to restructure that surgically is basically creative anatomy. This is what we have to focus on. You have to come up with a plan. You have to implement the plan. You have to modify the plan until you get the most perfect result possible on that particular person. Same thing with rhinoplasty. The rhinoplasty changes. We've gone from internal incisions to external incisions. Now, I have kind of a pet peeve with that because I'm old school. I do my rhinoplasties internally. The incisions are inside the nose, so you don't see any scars. And there's nothing that I can't do internally that some of these other doctors have to do by opening the nose and making a scar across the columella, which is that little tissue between your nostrils. So my rhinoplasty skills, I think, are impeccable. And not to brag, but I think I turn out really good noses. If you look at my website, we have one of the most extensive galleries of before and afters for rhinoplasties in the country, if not the world.
So that's a good question. Why are they doing external then? What's the benefit of doing external? Not just
Internal one, yeah, sure. Number one, and as the obvious, you have a scar across that tissue. You don't see the scar. It's a telltale sign of having a rhinoplasty.
Right.
Number one. Number two, the prolongation of the swelling. You know, when you operate on the nose, you change all the internal structures. The cartilage and the bone have to be restructured to fit the new concept of the new nose. And swelling occurs postoperatively, and that swelling is minimized with the internal technique. So those are the two main things. We get to see the result more quickly.
I like that. I do. I like that. So that goes to now you have your practice, and now now we're at the COVID-19 shelter at home stuff happens, in March or whatever, it starts to happen. Did you always offer virtual, or was it something you developed recently?
No, we've always offered virtual consultations because we have a clientele that spans the globe. We get people from all over the world. So if you're outside of our geographic area, then you have the opportunity to have a virtual consultation. And the virtual consultation begins with an interaction between the patient and the surgeon and the cosmetic consultant. She interviews the patient, they submit some paperwork, they submit their photographs, they give us permission to have their photographs, and then the chart is combined and the coordinator gives me the chart, and I have an opportunity to review the chart. And once I do that and examine the photos, it gives me an opportunity to formulate a surgical plan. Now that surgical plan then is relayed to the patient, and then they can decide which way to go from there. Now, there's no substitute for an in-person exam. You just can't do medicine without that. But this is a gateway to do that. So now with COVID, we've expanded a practice that we've had forever to include everyone who wants to submit, including the local people.
So I want to break it down. I want to break it down, Dr. Tom. So, okay, I come to you and I'm like, Dr. Tom, I hate my nose. Let's do something. So I talk to the consultation. So do we do it through Skype? Can you do it through FaceTime? Can you do it through, so like, how's a person first?
Yeah, there's several visual interactive capabilities that we have, and we can use one or all of them depending upon what method the patient has available to them.
Good.
So
okay. They could do this. So you can set that up. You say, okay, I want to do it through Skype. You guys could do that, or FaceTime. You guys can do that.
Well, that interaction usually is with the patient coordinator. Now, once I get the photos, that's all I really need. Once I have the past medical history and kind of get a feel for the psyche of the patient and their own personal aesthetic tastes, that helps me to begin to formulate the plan to achieve their goals. Then, sometimes I'll get involved with a Skype or a Zoom or something as well, but most likely that's limited to the patient coordinator.
All right, so I talk to the patient coordinator and she tells me what I need to do. So she'll send over probably through email, like here's the forms to fill out. And now pictures, that's what I'm gonna talk about, because you guys are gonna need the most accurate, clear picture, right? So so you want us to take our cameras and go, what do you tell people?
Right.
Yeah.
We try to get someone else to take the pictures. The selfies are very distorted.
Okay, that's good to know. Okay.
Right. So especially of the face. So we try to get someone else involved, some significant other, with a clear, clean background. We try to find a wall that doesn't have any stuff on it, that has a relatively pale color. And we try to help position them. The patient coordinator helps position them properly so we get the most accurate anatomic views possible under those circumstances. Now, once we see the patient personally, we have a very structured mechanism of taking our photos.
Sure.
They have to be reproducible identically. So if we take a picture from the front, the focal length has to be the same, the coloring has to be the same, the lighting has to be the same. But from a preliminary purpose, the virtual consultation photos are adequate.
Okay, that's what I was wondering. I was like, okay, I'm like, there has to be. I'm like, there has to be make sure that That's a good question about selfies. I didn't realize that they do kind of distort. And like, no filters, folks. No, like that kind of stuff. Don't try to make it look pretty. You're trying to show. You really try to show the most accurate version, so they can get so you can make an accurate diagnosis, right? I mean, that's the whole thing, right?
Yeah.
That makes sense.
Some of the photos we get are of private parts, and so people have to be aware of who's seeing them. We have to have some HIPAA compliance and some security with respect to breasts and lower abdomen and buttocks and different areas of the body. So we have to be cognizant and aware of the patient's confidentiality.
Oh, that's great. So then you send all documents over. Do you do like electronic sign and stuff kind of now? Is that the kind of thing?
We have both. We can do electronic sign, or they fill them out when they come in eventually. But the virtual is all electronic.
Oh, okay, we do that. Okay, and then so then you get the stuff back, and then they said this is where you actually come in. This is when you start overlooking all the information, the charts, everything they need, and then that's when you do a phone call and say, okay, let's talk again, because right now we can't really come in yet. So what is next?
Yes. Once I review the chart and I come up with a plan, say you need your nose shortened, you need your nostrils reduced, you need your tip to your alar groove. I come up with a surgical plan and a recommendation to achieve the patient's goal. That has to be relayed to the patient, most often by the surgical coordinator. She'll intercede on my behalf with respect to that. Now, periodically, I'll get on the Zoom or the FaceTime myself and help the patient. But usually, the patients who come to us have done an extensive shopping. They've gone online, they look all over the place, and more often than not, if they want their nose done, they bring in I'll ask the patient, what do you like? Show me a photo of the nose that you think will fit you. And more often than not, they choose photos from our website.
Okay.
Which is really helpful. I like this nose. I like that nose. Can I get this? Can I get that? And then I offer the limitations, your particular situation. If you got thicker skin or if you got missing bone, sometimes I'll have to use cartilage. We can buy cartilage from the cartilage bank, which is great. Talk about technological improvement.
Yeah.
We have bone, we have tendons, we have cartilages that we can buy from the tissue bank.
Wow, that's amazing.
It really helps achieve our results more dramatically.
So right now, until I know Florida's doing the Los Angeles, in California, we're still in lockdown, and they're talking about a few things here. But so right now, you do that, and then and like I said, it's all kind of like gathering information, getting stuff together. So then right now, what's kind of been the next step? You can't come in yet, can you? Or can you come in? Or
can't come in yet, but we've heard rumors that early May, we might be able to see people. We've got some people scheduled for the middle of May. Hopefully we'll be able to move forward. I've got a backlog of many patients that have already paid, that were scheduled, that we've had to cancel, and now we're working on rescheduling them. Keeping in touch with them, we're sending them emails, giving them updates on what's happening, because a lot of our patients are college students and young women who have other lives besides doing their cosmetic surgery. Try to fit it in at a time when their family members are available and they've got the money to do it, and it fits their lives conveniently at now rather than later.
So this is more of a like, you can continue the process and kind of get things or get all your ducks in a row, so to speak.
Right.
So that when it's time, we can. Then the next step would be scheduling. We'd be coming in and scheduling it. Probably be the next steps.
Yes, everything can be done up to the point where I actually touch the patient.
There you go.
You can't practice medicine without laying on of the hands, right?
Yeah.
And so I have a very specific technique of evaluating the nose and the breasts and the belly and the buttocks and the arms and the legs. So that has to be done in person. So everything up to that point can be achieved. But once we see them, by then they've been working on their finances. They know they want to go forward. It's just a matter of when. And then we have to find time in our schedule to fit them in.
So why do you feel people should, at some level, still kind of continue if they were thinking about it for the pandemic hit and still want to get it done? Why do you feel like they should just go this route? Just keep it going and then hold until we get to go further.
Well, people's motivations are their own personal business. For example, in the United States, there's somewhere between 250 and 300,000 rhinoplasties done a year. That's a very small number compared to the entire population.
Yeah, right.
But these are people who have been living with this issue for their lives most of the time, and we can't really operate until they go through puberty. So we can't take a
Oh,
14-year-old and do her nose because her nose may be still changing. We can't really do any breast surgery in pre-puberty as well. So this service is offered to adults. When puberty is ended, they can start looking, and you'd be surprised because I ask patients, when did you first start to notice your nose was changing?
yes.
10, 11, 12 years old. The nose starts to change, and they've been living with that. Now they're 19 or 20 years old, and they're sitting in my chair, and these poor kids have been living with this nose for 10 years before they had enough courage to come and get a consultation.
Right.
These are really life-changing procedures,
Yeah.
and you'll be surprised the emotionality. Once when you finish a nose, you've got packing and you've got a splint. Packing comes out about 5 days.
Okay.
Now, not all doctors pack. I like it because it gives me a more dependable structure. When the splint comes off at 2 weeks, that's their nose. It's about 80% of their final result. And some of these patients just burst out into tears because they wanted this for so long, and now all of a sudden they're seeing it.
Yeah.
So it's a very fulfilling moment in our lives and in the office procedures.
So you also probably do not just cosmetic. Do you do any kind of people who actually need their noses changed for reasons like
Yeah, we do functional and cosmetic, but
because they get to
like
work.
I said earlier, my roots are in reconstructive work. As a resident in Milwaukee, as you may or may not know, Milwaukee makes machines that make machines.
Oh, okay. Okay.
Right?
Got it.
They're
Okay.
machines that make machines.
Yes.
So they have things called punch presses. And inadvertently, you may lose a finger at your wrist or a mid-arm or a leg, and it's a rural area. So we have different types of agricultural machines that do really damage to extremities. We have to spend hours and hours putting these patients back together under a microscope. This is microscopic reconstruction of nerves and arteries and veins and bones. And that's my roots.
Yeah.
But then as I matured in my practice, I became more enamored with the concept of cosmetic surgery. So yes, I've done burns, I've done cancer reconstruction, I've done microvascular free flaps, I've done it all.
Yeah, but I know you're also, I'm going to show you, I read these. You also were certified by American Board of Plastic Surgery, a member of the National Association of Aesthetic Plastic Surgery, and you were previously a member of the American Cancer Society, which we know AMC, we know them, ACS, we know them. And also we have a connection. You worked at Kaiser in Oakland. You were part of Kaiser in Oakland, California. I'm in Oakland, California. I used to go to that Kaiser all the time. My godson was born there. I know Kaiser in Oakland.
I went to med school in Nebraska, and as you may or may not know, many people in Nebraska are enamored with California.
Oh, really? I didn't know that. Okay.
So people in Nebraska, when they retire, they go to Arizona or California. People in the Northeast, when they retire, they go to Florida. Okay, so I had 4 or 5 of my classmates got into school in California. And I was accepted into a surgical program at Kaiser Permanente in Oakland. But I lived in the Lower Mission in San Francisco. I rented a room.
I used to live there too. Oh my goodness, I know Lower Mission. I used to live there.
I rented a room from the nursing supervisor at San Francisco General. I rented a room from him. So every morning I would get in my little car and I would drive across the Oakland Bay Bridge against.
You didn't take BART?
No, I didn't take BART. I had to drive my little purple Pinto.
Hey, a Pinto. I love that. Oh my God, a purple Pinto. I wish I saw that. I wish I could see that. I love it.
So yeah, I spent, then when I finished my internship at Kaiser Permanente in Oakland, I stayed on there for a year to work in the ER.
Oh, okay.
And I had a couple buddies and we had weekends off. We would go over to Hawaii for the weekend. Tickets were cheap then.
Oh yeah.
I learned how to sail and snorkel. So I had some other extraneous activities.
I love that. Oh, I thought that's so funny. Yes, I live Lower Mission also too. So I'm looking at your awards back there. As I wrap this up, I mean, you've been wonderful. What's it like to win awards for doing something that's I mean, you don't go to do this for awards. You're doing this to help people out. It's a medical thing. So how does it feel to win awards and best of?
The awards are really a reflection of my focus and my commitment. I'm never looking for recognition. I'm always trying to do my best. And as you achieve that level of success, you are compared, not by yourself, you're compared to others by some organizations like Real Self. We find Real Self participation very, very helpful. This organization is dedicated to helping patients interact with doctors. Talk about virtual. They offer questions and answers, and they put up their questions, and then we physicians can go through them and answer the questions, basically getting a free consult online to a degree. But yeah, the awards are very fulfilling and very humbling, actually, to get an award. It makes me feel really good. But I'm telling you, being a plastic surgeon is really my calling. And I just live it every day and have for decades.
I feel it on you. I feel it on you. I feel like this is what you like to do. I feel like Dr. Tom. I could tell you do. Well, thank you so much for being on the show. You are a delight, and I hope that things get to some semblance of normal so you can actually help people with their issues.
Very good. Thank you so much, sir.